Hi everyone, it's Rishma from OT for Life. Hope you're all doing well. Just wanted to continue on with the stress management videos and talk a little bit about what is it that actually initiates or sort of instigates that stress response in us. So if you think about yourself and your own situation, what is it that you think actually initiates that response in you? Is it something in the external environment that happens to you? Is it just maybe your emotions that come out initially in the stress response? Is it your physical response? Is that what actually instigates that when you feel your heartbeat faster, that lets you know that you're kind of under stress? And is that what is sort of the initiator for you? And what I'm going to tell you is actually the initiator for all of us is none of those things. The initiator for all of us is the thought that we have about the situation that we're in. So it's our perceptions or thoughts about either an event that's happening right here, right now, or something that we're remembering from the past, or something that we're worried about or anticipating that may happen in the future. So the initiator of the stress response is actually our thoughts. And then through our thoughts, we start to feel certain uncomfortable emotions, like fear, like anxiety, like anger, like resentment, like hostility. And then the uncomfortable emotions lead to the physical responses that we actually experience, our heart beating faster, or we get sweaty, or we get shaky. And we've talked about that hardwired stress response, right? And then what happens is, to close the loop, is that actually determines then our choices and behaviors and actions, right? So it starts with a thought. We have certain perceptions of something being a threat to us, whether it's a person or an event. So we perceive that as a threat. We experience some uncomfortable emotions around it. We also start to experience some physical sensations with it. And then that actually determines our choices and behaviors in terms of what we're going to do or what action we're going to take. So the really important thing to understand is that it starts with your thoughts. So if it starts with your thought, you want to make sure that you reflect and take the time to figure out what your actual thought is in a given situation. Because most of us can identify the physical symptoms that we're having, or we can identify the uncomfortable emotions that we're experiencing. So we can tell or identify when we're actually responding to a stressful situation. The harder part is to actually rewind it back to figure out, okay, what was our actual thought that started this whole cascade? What was our actual thought? And then once you discover what your thought was about that particular event or situation, then you can actually challenge your thoughts to see if you can actually follow them and go, well, is it actually true? So the questions you want to ask yourself when you're having a particular thought and it's causing you stress and you're understanding that now, is that thought true? Is it? Because a lot of times we just make assumptions and we make judgments, but it's not actually fact. We believe that it's fact because we feel so bad about it, so we believe that it must be true. But ask yourself, is it true? Is it fair? So the thought that you're having, is it fair? Because if you're thinking a certain way about someone, or you're thinking a certain way about a situation, is it actually fair for you to think in that way? And is it necessary? Is this really going to matter 2 or 5 years down the road? So those are some of the things that you can sort of start to ask yourself once you can figure out or identify exactly what thoughts you're having that's initiating this whole stress response. And by changing your thought, I know it's easier said than done, but by changing your thought, you can actually change that cascade. You can change the uncomfortable emotions, you can change the physical symptoms, and you actually can change the behaviors and actions that you choose to take as a result. So it all starts with the thought. Hope that was helpful. Take care, everyone. Until next time.